To deliver high-quality CPR, begin with high-quality chest compressions. Proper CPR can be tiring, so make sure to ask to switch positions when exhausted if another rescuer is available to help. To provide CPR, first make sure the scene is safe. Approach the victim and assess their responsiveness by tapping them and asking them loudly, "Are you okay?" Yell for help. Use a cell phone to call 911 or your local emergency medical service, or EMS, and send a bystander to get an AED. Check the victim's breathing and pulse. If they're not responding, breathing, or only gasping, start CPR with compressions. It's essential to minimize interruptions in chest compressions to 10 seconds. Perform 30 chest compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For adults, this is at least 2 to 2.4 inches. That is 5 to 6 centimeters. To begin, position the individual on their back on a firm, flat surface. Feel for the end of the breastbone or the sternum. Place the heel of one hand on the lower half of the breastbone. Avoid pressing down on the very end of the breastbone, as the bony tip, known as the xiphoid process, may break off and cause damage. Put the other hand on top of the first hand. Press straight down. Let the chest rise completely between compressions. Your hands should remain in contact with the individual without bouncing or leaning on them. Rescuers who are uncomfortable performing mouth-to-mouth and do not have a mask may perform hands-only CPR and give compressions. Most masks have a pointed end, which should go over the bridge of the nose. First, place the mask over their mouth and nose, then open the airway by performing the head tilt chin lift maneuver. For the head tilt chin lift maneuver, open the individual's airway by first placing one hand on their forehead. Place your fingers on the bony part of their chin. Then, gently tilt the head back while lifting the chin. If there's no good seal between the mask and the individual's face, it will be ineffective. Give a breath for over 1 second and watch the chest rise. Deliver the second breath. If the chest doesn't rise, reposition the airway. Let the head go back to a normal position and then repeat the head tilt chin lift maneuver. Then give another breath and watch for the chest to rise. If you suspect the victim has experienced head or neck trauma, the jaw thrust maneuver should be performed to open the airway instead of the head tilt chin lift maneuver. To perform the jaw thrust maneuver, place the index and middle fingers on the lower jaw to physically push the lower jaw upwards, while the thumb is used to push down on the chin to open the mouth. When the AED arrives at the scene, turn the device on. Remove any clothing from the victim and apply the AED pads. Place one right below the collarbone and the other to the side of the left nipple below the armpit. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR, beginning with chest compressions. If shock is advised, clear the victim again before delivering a shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR, beginning with 30 chest compressions. Open the airway and give 2 breaths. Continue at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives. CPR for infants is almost identical as it is for children. If an infant is not responding and not breathing or only gasping, give 2 minutes of sets of 15 compressions and 2 breaths. In infants, push hard and fast as you would in a child or adult receiving CPR. Move any clothing away from the chest and place 2 fingers of one hand on the breastbone, right below the nipple line. Push straight down approximately 1.5 inches, that is 4 centimeters, at a rate of 100 to 120 beats per minute. Let the chest recoil to its regular position after every compression. Remember that an emergency system dispatcher, 911 in the United States, can also guide you through the steps of delivering basic care, performing CPR, or using an AED until additional help arrives. Thank you for taking the time to learn how to save a life.